SAPIEN 3 has changed our practice, and it's just expanded the patient population one step further. I think if you look carefully at the trials that have been done, transfemoral is really the way to go. And transitioning from the XT to SAPIEN 3 has allowed us to treat more patients with the best evidence and get the best outcomes.
So for me, the most compelling data from the partner dataset are clearly the mortality rate at 30 days, which is 1.1%, and also the extremely low rate of stroke, which is 1%.
The benefit I saw in my patient with the SAPIEN 3 were mainly related to the addition of the skirt. We were able to tackle patient with ovoid annulus and decrease the rate of perivalvular leak, which is one of the major issue of those type of valve. The other added benefit of those patients is the easier access to the ventricle, the smaller sheath. It's very similar to a vent that we would have put in the LV, so there's much less risk of bleeding, especially in those older patients with friable tissues. Another benefit that what we saw is the fact that it's not shrinking at the same rate in the upper part and the lower part, which make it more convenient in patients with previous mitral valve replacement.
The patient that I can treat now with SAPIEN 3 that I was not able to treat before are those with marginal access and those with large annulus. Those with very large annulus that we could not treat confidently with the earlier iteration of the device. Now we can treat confidently that we won't get a PVR even in annulus that are as large or close to the nominal area of the SAPIEN 3.
Clearly, two benefit of SAPIEN 3 device is that it's extremely easy to use, require less maneuver, is very predictable. When you identify the appropriate size of your valve, you can go quickly within 20 minutes do a case and be sure that it will be well implanted and appropriately sized with no PVL. One advantage of the SAPIEN 3 also is the fine-tuning, the refinement of the valve implantation by itself. With the SAPIEN 3 device, easily you can make sure you're coaxial, you can make sure you're the appropriate depth of the device, which can reduce actually conduction anomaly and also preclude coronary obstruction. So clearly this new feature on the SAPIEN 3 device allowing us to have a perfect and reproducible valve placement is unique and welcome.
When you look at the SAPIEN 3 device and what it allows us to do, it's clear that we've got a heart team that delivers TAVIs for us, right? And bringing all those people together is always time-consuming and challenging. Having a device that's easier to deliver, safer to deliver, faster to deliver, and easier to position and manipulate has really sped the time of our cases. We're now doing routinely 4 cases every TAVI day, and typically we're done by 3 o'clock in the afternoon. So it's less impact on team fatigue, hospital resources, and the vast majority of our patients are rapidly mobilized and go home the next day.
So I think from a Canadian point of view, the efficiency of TAVR use is extremely important. We have a long waiting list. We're limited in the number of cases we can do per year. So I think to have a system such as SAPIEN 3 that allowed us to perform more procedure per day or per week or per month is extremely welcome. And I think SAPIEN 3 device will clearly improve efficiency, decrease length of stay, and probably let us to do more procedure.